Our job as healthcare providers and oncologists in particular is to take all of the results of all of the tests, integrate them, and create a plan of attack. How are we going to deal with this particular cancer? Are we going to use surgery? Are we going to use radiation? Are we going to use drugs? If so, what drugs? And how are those drugs going to affect the patient? So our job is to integrate all of that, and if you will, as the point guard or the quarterback, call the play that's going to go forward. Map that out for our team, map that out for the patient and their team, and then carry that forward. And our job is really to explain that as best we can to everybody around us so all people can be prepared for what's about to occur. Whenever we see a new patient with gastric cancer, really any kind of cancer, we have to understand, where are we? We call that stage, right? So what stage is the patient? How far along is the tumor? Where has it spread? Where hasn't it spread? Is cure an option or not? So we make that assessment, number one. Number two, as the most important things we have to know, is what are the characteristics of the patient's tumor and the patient themselves? What other medical problems does the patient have that may help us, may not help us as we go forward? What are the characteristics, the molecular characteristics, the location of the tumor, et cetera, that can help us understand what the best therapy will be for that individual patient? And then number three, what are the goals of the patient? Most patients, when they first are diagnosed with a cancer, they have one goal in mind. They want to be cured. They want to have this thing fixed. And so as best we can, we have to see that we're aligned with that goal. Is that possible? If so, what's it going to take to get there? And how are we best going to travel that road together? So those three elements are critical in making that management decision.